I've had vendors who, no matter what question I ask, can you do this? The answer is always yes, until I ask them to show it to me.
Hello and welcome to the Healthtech Marketing Podcast, brought to you by HIMSS and Health Launchpad. Hi, I'm Adam Chirinos. I'm Health Launchpad's founder and CEO, and I'm your host for today. I want to give a massive thank you to my great friends at my partner HIMSS, especially a big shout out to Eula Kim, who helps me produce these. She does a fantastic job. And also a big thank you to you for joining us today. Today I'm really delighted to introduce you to our guest, Melanie Turner. Melanie is an MSN RN and Associate Vice President in the Health Systems Information Services Department group within UAB Medicine Enterprise. Melanie's going to tell you a bit about this, but you know what I'm so excited about today is that, usually more often than not, we have people who are marketers on the health tech, for working for health tech companies. And it is just such a privilege to actually hear from a customer, somebody who can actually give people who are trying to sell and market to folks like Melanie. And Melanie can provide a bit of perspective on what it's like to be sold to. So maybe they'll do it better. So Melanie, thank you for joining us today. And I'd love it if you could just tell us a little bit about yourself and your organization. Tell us a bit about UAB and the work you do.
Okay, great. And thank you for having me, Adam. I'm looking forward to talking with you today. So UAB Medicine Enterprise, for those that don't know about us, we're located in Birmingham, Alabama, and we're comprised of hospital and clinic entities. We are a recognized leader in quality patient care, research, and training. We've been recognized by U.S. News as the best hospital in Alabama, nationally ranked medical programs, and over 350 physicians among the best doctors in America. We have the only level 1 trauma center in the state of Alabama, and I'm very proud as a nurse to say we are a 5-time magnet designated nursing service. That's something that only 21 other hospitals in the entire world have ever achieved. So very proud of our nursing service for that.
That's really huge. Yeah.
So as far as myself, I'm a native of Alabama, in case you can't tell by my accent. And I have had the pleasure of working at UAB Medicine for most of my career. My background clinically is pulmonary and critical care medicine. I also did some work in quality and nursing leadership. And then from an information technology side, I've had the opportunity to work in instructional design, system development, project management, as well as leadership.
That's really interesting. I'm always so blown away by what nursing does within healthcare, and it's not surprising seeing so many people in nursing rise into really, like yourself, into leadership roles that go outside of care, or sort of any sort of fit day-to-day hands-on care. And in many cases, I've spoken with several CEOs in the last few years who are RNs, and it's just, I'm not surprised. I always think so many of you are just awesomely competent. Tell me a bit about, from an IT perspective, what your group does, what's their role, and how does it function within the organization?
So our department serves the organization in a variety of ways. We provide IT services to our core entities, which include our academic medical center and clinics. We have clinics throughout the region, so throughout the state and into neighboring states. Our IT services that we provide include things like desktop support, enterprise system management, data analytics, application development, as well as information security oversight. And that's just to name a few. We also provide a variety of services to our affiliate hospitals. And depending on their needs, we partner with them to help support whatever they need and any gaps that they may have in their IT.
How big's the department? Roughly how many people? Yeah.
We're close to 400 people now.
Oh.
So a large department, and we have one of the largest hospitals in the United States now from the academic medical center standpoint. And over, I lose count of the number of clinics, but well towards 200 plus clinics that provide services to our patients.
Terrific. That's really, really terrific. So, tell me about, actually, first of all, as much as you're comfortable, tell us a little bit about the technologies that you have, the EHR and other key technologies, and then, what your platform looks like.
So we have, from an EHR standpoint, we have a core vendor that we use, and then we use a variety of third-party tools to integrate other functionality that may not be provided from the core vendor. And, that's the great thing about the way technology is progressing with interoperability, with FHIR and API development that's coming forward. It allows us to give the providers of patient care a better experience because it's more seamless to them through using mostly that EHR interface, but maybe connecting to a variety of systems.
This is something I think that's changed quite a lot in the last 3 or 4 years. Is that I remember with my own software company, we were very interested in FHIR and having lots of conversations with various healthcare systems about it. But, frankly, I think mostly it was sort of still very much in a kind of an investigative stage. But from everything you're saying, and from what I'm seeing from other organizations as well, FHIR is now much more widely adopted, right?
It is, and it's still developing. I think there's still, in some places, work to be done, but the promise of what we can do through that technology is just fantastic.
Can you give some examples of maybe some applications that that have been that have been piloted or have been deployed that use FHIR?
So in one of our surgical areas, we use a third-party tool that integrates into the record so that the providers can see what the patient has recorded in surgical recovery in terms of symptoms. They answer questions. Our providers can see what that looks like. They don't have to leave our EHR to see it, but the patient doesn't, can use their side, the patient-facing side of the same tool to share information. So that's one example. Yeah,
that's terribly interesting, and you can immediately project in how that's going to help your organization make sure that the patient rehabilitates, and the benefit of that is healthier patients, obviously, but also lower readmission rates. I'm sure that that hopefully you're seeing that as a result of it. Very interesting. So how is technology purchasing changed in your organization over the last couple of years? I mean, obviously COVID, just got pre-COVID, COVID, and then now it's not post. We're certainly not post-COVID, but we're changing into a new phase, I guess.
Sure. So definitely there are some things that have stayed the same throughout. One thing that probably did change with COVID is where we've learned how to adapt and be a little quicker in some of our processes with evaluation. But, our core processes with any new technology is trying to make sure we understand the business need. What's the problem that we're trying to solve? And clearly define what it is that we're looking for. before we go out and look at technology.
So you start with a problem definition, spend some time on the framing the solution. Yeah. And then go look at vendors. And so who gets involved with that? I mean, what is the, as a software guy, you always talk about the buyer collective. I'm sure you guys don't think yourself as a buyer collective, but how do you get organized?
So, it can happen in a variety of ways. Certainly there's a normal budgeting process where we talk with our key stakeholders and understand, what their business needs are, what the gaps are, so that we know if there's something we need to start looking at for a normal budget cycle. And then there's things that happen like in the pandemic where you have to turn quickly and there's a need identified, and obviously it doesn't follow that normal cycle. So remote patient monitoring is an example of something. We had to pivot quickly when there were patients that we needed to monitor, couldn't necessarily bring them all in the early stages of the pandemic, but wanted to be able to still connect with them and know what was happening. So we were able to very quickly identify a vendor solution and implement that within a very short amount of time.
So now have things settled down a bit? And is it back to the way things were pre-COVID, or is it a different, does it feel different?
It does feel different. I think all of us have learned how to be more efficient with things and how to streamline some of the things that we do. So I do think it feels different, and probably will continue to try to keep some of the lessons that we've learned during the pandemic.
That's great. I know that something that if you talk to any software salesperson or marketing person, the one thing that you can be sure that we will all complain about is how long it takes to make a decision in healthcare. And I remember, trying to explain that to my investors. They're like, yeah, well, yeah, great, yeah, but why aren't they closing? But why aren't the deals closing? It's like, because they just don't. That's healthcare. So it'd be great if that changes, but I wouldn't bet my mortgage on it.
I'm not saying it's going to be quick. I'm going to say it might be quicker. How about that?
Yeah. Oh well. Yeah. Wouldn't that be amazing? So, how frequent? One of the things which I'm always quite surprised about when I talk to folks like yourself is how many projects that you have going on in any given year. So, I mean, kind of ballpark, how many projects are there, order of magnitude? And then how do you decide what you're going to do and what you're not going to do?
Well, that's a very interesting question. We currently, if I had to ballpark it, I guess we have probably 40 active projects that are fairly large in scale. And that, because that's a whole nother podcast if you want to talk about projects and what sizes of projects and complexity.
Right.
So we probably have about that many. And so, depending on the timing of those and what areas need to be involved and the scope, that kind of dictates how many you can do of what type, partially because of the IT resources needed, partially because of whether it's clinical or business resources needed, and how much change can be absorbed at one time. The impact of the change, it depends on whether it's a smaller subset of people or a large subset of our population.
Right. And so how do you decide, what's the process for making a decision on what you're going to do this year? Or in this case, it's probably like what you're going to decide to do next year, and what you're not going to do. How do you decide on what makes the cut?
So for us, given that we're academic and have several different boards that certain things have to go through, part of our process is identifying the needs, identifying targets, and then understanding budgets. We have a process where we put together a package that explains what a solution may be, what it's going to cost, both in dollars and resource, time, and effort. And then talk about the expected benefits, any return on investment, try to really put that whole business proposal and business case together. And then there's a leadership team that helps evaluate those to determine out of those, which are going to go forward. Some things require board approvals depending on the cost.
Yeah. So you talk about 40 projects. Now, it sounds to me like those are 40 really big, sizable projects. Do you also get involved? Are there lots of other projects that are coming from sort of different departments? Maybe it's an academic department. Maybe it's, an ambulatory services department where they've got their own budget, but they need you to help implement or manage it. How many of those are there?
Oh gosh, that's a fun question because there's a lot of different ways you can be funded within our organization. And so we have a research arm. So there we have a lot of research grants, research funding. We do a lot of innovative care model things. So there's a lot of grant funding sometimes available through different federal or state agencies to try different models of care or different things. And so there's always areas that reach out and need some sort of assistance and services. And some of it may be small. They may need equipment, or they may need integration, or they may, need a larger set of support. They may need data.
Yep. Right. Yeah, absolutely. With FAR and AI, that's the beast is even hungrier for data. So let's just change gears. I'm really interested in about, how you personally, what are the sources that you go to? What are your trusted sources for going through a technology process, for learning about a problem, about learning about different solutions, and then figuring out who you should talk to?
So, for us, trusted sources include class. So understanding class reviews of different vendors in a market or segment is important. Gartner is somebody that we trust, and we use a lot of insight. We get a lot of insight from their data and their analyst calls. And then, of course, we like to talk to people that we know, people who we think are like us, and you can't see my air quotes, but other large academic, people that might fit more our same profile, to understand if they have that same technology, how it works for them, or that sort of thing.
And how do where are the fora for doing that? Where do you connect with them?
So a lot of them, there's a lot of consortiums that we belong to as an organization, and a lot of professional societies. Certainly HIMSS is one.
Yep.
And Chime is one from the IT side. So there's various organizational venues that different leaders are involved with that we make connections and talk about a lot of different things, but certainly technology and tools are some of those.
I see. What about things like social media? Is there anybody, are there people that you follow? What are the types of channels that you might look at?
So from a social media perspective, I have a very tiny presence on LinkedIn, but I know a lot of people do use LinkedIn and connect with others in the industry. Certainly UAB Medicine has used things like Twitter to market and to talk about what we do as an organization. And I actually am more of a follower of people on Twitter because that's easier for me when I, have 5 minutes of downtime in the evening.
That's interesting. I always wonder about Twitter, it's I have personally, I've been involved with social media since the start, and I find it so distracting that I can't do it. I just have to sort of switch it off. But I seem to spend my life on LinkedIn. But it's very interesting from your perspective. It's like, when I need it, you go to Twitter because it's actually quite a good source for searching for things. That's really interesting. So when companies sell to you or market to you, which are the ones that, actually, I don't want you to name names, but with companies that do it well, what do they get right? And then the other side is, the ones that do it wrong. What are the things that we'll come on to that afterwards? But let's just focus on the ones that you think, yeah, these guys are doing it the right way.
So, I think first is having a good understanding of our organization. And so people who come and don't seem to know anything about UAB, what we do, what our mission is, it's going to be hard as a vendor to align with an organization if you're not clear on what they do. And so I think it's very important. We look for vendors who want to be partners with us, who want to be collaborative with us and help us succeed. And in turn, we want to help the vendor succeed. So I think people who come at it from that partnership approach are the folks that I see do it right. And I don't know if salesy is a word, but people that are too salesy or pushy tend to, and at least for me, tend to make me go, okay, I can't deal with that. I need somebody who understands what we need and understands kind of the right cadence of communication, the right type of communication.
I want to pick up on this notion of partnership because I think that technology companies like to say we're your partner. I've always taken the view as like, it's not up to us to say we're your partner. It's up to you to say it, because partnership is something that I think as you're a vendor, you earn the right to be that. So what are the kinds of what are the types of things, peel that back a little bit about the things that companies do that earn the right to be, you're a partner. Your behaviors and the things that you're doing are what we look for in a partner.
Yeah, so people that are partners with us, in my mind, they understand us and our mission and what our needs are, and they're very clear to us about what they can or cannot deliver. And in what time frames they can or cannot deliver something. So people that are transparent about where their product is and where they're going with it, I think that's important from the partnership standpoint, because if we don't have open, honest communication, because you're working to sell me something instead of just really laying out the facts, then there's a lack of trust there. How can I trust you? And that's in the early sales process. And then, in the contracting phase, people who want to nickel and dime you for every piece and part of things, and who I guess maybe see a large academic medical center as somebody who's going to have more cash than a smaller place. I don't know,
Right. So I heard several things in there. I heard, first of all, the notion of building trust, not nickel and diming, transparency, and sort of saying what you can and can't do, because that goes towards earning trust. And then I thought, the other thing that you said, which I think is very helpful, is showing that you really understand them, that you're not just, another prospective customer, another target, that you actually have taken the time to really get to know your organization. So I can see how that works in a sales standpoint, but earlier, the challenge. So flip it around, right? The challenge that companies have in selling to any healthcare any organization, frankly, not just in healthcare, but particularly in healthcare, is if you think about the journey that you go through from somebody initiated, we need a new piece of software that's going to do X, Y, this scheduling. Whatever it could be anything, right? So there's a process that you're going to go through, and over the course of that process, you're going to do research, and you're going to talk, and you're amongst yourselves, and you're going to define the needs, and you're going to reevaluate that. You're going to look at different solutions, and then right towards the end, you then start, as I understand it, you probably start talking to vendors. So what in that early phase, before you're ready to actually have a conversation, what are the sorts of things that vendors put out there that are of value to you?
So, one thing that I love, and I've seen some vendors do a really great job of it, and some, not as well. But having a website, a marketing presence online where I can go do my own research, I'm clear about what the product does. I might can see some short videos. They do, vendors that do webinars with customers that talk about, success stories, what a certain organization has done, always piques my interest, because I like to hear if they have, clients that have implemented and have some success. I like to hear what that looks like. I like to hear what their plans are. So, here's the cool things we're working on, and we're planning on having this available later this year, or, that kind of thing. I think all that is helpful for us to understand not only what a company has, but where their mission is and where they're going.
Yes. That's it. That's interesting to hear, that case studies and webinars, customer success stories is not surprising, but it's important, the point that, you're not just looking to buy a piece of software that's going to get serviced. You're looking to actually have a relationship with a company that's going to be there for the long haul. I've certainly, saw that early on in our career, is that people would say, we love your product, we like your team, we just don't know if you're going to be around. So that matters for bigger companies too, because there's a lot of consolidation going on, right? Everybody's buying everybody at the moment.
Absolutely.
So, yeah. Okay. What about pet peeves? What are the sorts of things that drive you? It's just like, I can't, wish they'd stop doing this.
Well, I've mentioned some of them. So, over-promising. I've had vendors who, no matter what question I ask, can you do this? The answer is always yes, until I ask them to show it to me. and then it's not quite so much. Or people who use buzzwords. AI is a big buzzword. So everybody has some AI tool. But what does that mean exactly? Is it really machine learning? Is it NLP? Tell me what kind of AI tool you have and what your target is in that market. And then, people who are cold calling or emailing, on a frequent basis, not maybe understanding that, from an executive standpoint, our time is limited and precious, and even our administrative staff try to protect us sometimes. So, understanding that right mix of how often is often enough.
Yeah, I always take the view is that, you're going to engage, if you've done a good job of making you aware of what we do and how we can do that for you and why we do it, then as long as we can somehow keep in the top of your mind, when you're ready to buy that thing, you're going to call us. And there's a love-hate relationship with email from the marketer's side. I hear a lot of companies saying, we're moving off email, or we're not using it anymore, or we intend to never use it again, but they can't not do it. They have to do it. And the same thing with cold calling. It's unfortunately, maybe a necessary evil, but if it's done right, it can be effective. But I can understand from your perspective, it's like, just leave me alone. So, just kind of a last question for you. But actually, so I've got two last questions. I've got my final question I ask everybody, which I'll come on to in a minute. But I've got one last question for you before that, which is, when I go back to my days of selling software, I would have, given a lot to have had a conversation with you. And so what advice do you have for salespeople and marketing people out there who are trying to reach you?
So, I think making things available through multi-channels, whether it's through LinkedIn, social media, even some of like HIM, some of the organizations that we're already going to for information and data, having some presence there will make me recognize a name, and then really starting the conversation with an engagement about wanting to understand us and our needs versus a straight, hey, I'm trying to sell you something. More informational. Here's our product. Would love to spend 15 minutes, because I'm more likely to give you a very short amount of time than I am an hour.
Right. But so breaking that down into sort of stages, it's, sort of from a marketing standpoint, some people talk about top of the funnel. I like to talk about it sort of like instead of early in the buyer journey. It's having the right information in the places where you're going to be, which is you're going to be, in organizations in associations like HIMSS, on their presences, their website, their events, having being in the right places in social media. But it's also then when you come to their website, it's being able to basically serve yourself, self-serve the information that you need to make decisions. And that's a lot of information. And then in that first engagement, don't rush to sell. Spend time to really make sure that you've listened and that you've given you the opportunity to explain the needs at a high level as well as at a specific level. Absolutely. Yeah. Good. Thank you. All right. So my closing question, this is, Melanie, I ask everybody this question, which is, if you could go back in time and give yourself one piece of advice, what would that be? Something that you wish you'd known earlier.
So the one thing I would say to my younger self is don't be so hard on yourself. I am a recovering perfectionist and a champion warrior. And, I've learned over time to let things go, but my younger self was very driven towards it's got to be exactly right. It's got to be.
Yeah, that's good. Well, thank you. Thank you for that candid answer. I really appreciate it. Melanie, it's been a great pleasure and really insightful hearing your perspectives, and I really want to thank you. And just to sort of wrap things up for the listeners, so if you're watching the video, you can subscribe to the podcast on Apple or Spotify or Stitcher or whatever podcast application you use. And if you're listening to the podcast, you can actually view this interview and you can see the conversation going on between Melanie and myself. And there should be a link in the show notes for you. And do subscribe. We've got plenty more guests coming up. This is episode 14, and we've got no plans of stopping this anytime soon. So again, I want to thank you, Melanie, for your time today. I want to thank HIMSS for helping us put this together. And I want to thank you all for listening or watching today.